Welcome to Vegas Circle Podcast with your hosts, Paki and Chris. We are people who are passionate about business, success, and culture, and this is our platform to showcase the people in our city who make it happen. On today's podcast, we have in the circle top plastic surgeon who specializes in a scar-free breast augmentation, tummy tucks, and BBLs. Let's dive into the transformative world of cosmetic surgery. We welcome in founder of Platinum Plastic Surgery, Dr. Christopher Costa. But good to have you in the circle, my man.
Thank you very much. I'm so excited to be here.
You got a great social media, man. I was laughing when I was doing my research on you, man. You guys have a lot of fun in your office, man. I was seeing, so.
I think that's like super important, actually.
Yeah.
You know, there's a lot of, I think, office culture. Like, you know, even as a medical office,
Yeah.
You know, the people that are there, like, you know, that energy, like patients see that, like,
For sure.
they feed off that. So, so we try to make it as, you know, it's still obviously a serious place. Like,
Sure.
there's still work that has to be done, but we do try to like make it fun and like not just that corporate, oh, like it's fake fun, but like, you know,
Yeah.
try to find people who enjoy what they're doing. And
For sure.
You
Yeah.
kind of bring up a good point though right off the bat is that, you know, medical business in general, every time I've gone to a medical office, it kind of had that experience where it's very quiet, very serious. I'm like, I get a little nervous just being there. It doesn't create like an exciting atmosphere. Do you put a lot of effort into doing that for the practice as a whole?
Yeah, I definitely, we spend a lot of time with our whole staff talking about the experience. Okay. Like, you know, as opposed to a medical office, like you get diagnosed with something, you have to go somewhere. No one needs to come to my office. Nobody needs plastic surgery.
Good point. Yeah.
You know what I mean? So everyone is there because they want to be there and because they're interested in, you know, in selecting our office. And a lot of it does come down to, you know, results are important, like surgical results are important,
Yeah,
right?
for
But
sure.
like for a lot of patients, it's about that feeling that they get when they're in the office. This is a place that you're going to want to come back to for your follow-up appointments. You know, if you have a problem, like, you know, these are the people you're going to be talking to on the phone if like they don't, you know, if the prescriptions don't get filled right or something like that. So, so we try to create that seamless kind of experience, and hopefully it's reflected like in the social media too. You know, because everybody is kind of on that same page. Like it's all obviously about the patients, but
Sure.
it's not just about the medical side of it.
For sure. Yeah.
It's making sure that everyone has a good experience.
That's good stuff. Yeah. So you're originally from Nevada, right?
Yep.
Okay. So born and raised your whole life in this area?
I grew up in Reno.
Okay. Oh, awesome. Okay.
So grew up in Reno as soon as I turned 18, you know, finished high school and just left. Moved to Hawaii actually. So
Oh, that's a big.
sounds nice.
Yeah. That's a huge difference. Yeah.
you know, jumped on an airplane and just said, okay, like I want it to be in the most totally different place that I can
Love
find. And spent, you know, a lot of my time kind of like figuring out who I was like out there.
That's awesome. Yeah.
Yeah, I was out there through undergraduate and medical school.
Okay.
And then I traveled all over the country for my medical training. So I spent a lot of time on the East Coast. I was in Boston for a little bit.
Okay. What part? Yeah. What area? I lived in New England for a long time.
Oh, you did?
Yeah.
Brookline Village.
Yeah. Okay.
Yeah.
Awesome. Okay.
Trained at Beth Israel Deaconess, one of the Harvard hospitals.
Yep.
And then from there, I went to Hopkins in Baltimore. So I spent a few years in Baltimore.
Awesome.
So,
Okay.
And then after that, moved to Texas and spent a long time in Dallas, actually. So
That's awesome. Yeah.
all over.
Yeah.
Look, I applaud you, man. I did an internship at Tufts Medical for 3 years, and I was like, I can't do that. I couldn't do the blood. I couldn't do the anatomy labs. I was like, I'm not built for this, and I'm happy I did the internship.
Tufts is that's a.
It was the most intense thing I've done.
intense over
Yeah, it was
there.
very
Yeah,
intense.
I've been
Yeah.
around there.
That's good stuff, man.
Yeah.
So what made you get into plastic surgery? Like, what was that decision?
You know, I usually tell patients like plastic surgery chose me. I didn't really choose it. I actually wanted to be an orthopedic surgeon.
Okay.
I was really into like the bros and the heavy machinery equipment and the drills and stuff.
Yep.
And they were like, "You're just like a scrawny, like you can't catch a ball." Like I don't know.
That's
They just didn't-
hilarious.
They
Yeah.
really like I just didn't like connect like with that group of people, I guess. And so I was kind of following my passion, going through more like trauma stuff. You know, I wanted to be that guy that could save the life of somebody who shows up, you know, a bloody mess or something in the ER. So that's kind of the direction I was headed. And but a lot of my mentors and people, they're like, have you ever thought about reconstructive surgery? About this, there's you just seem to have kind of a good, you'd be a good fit for that. And I thought it was a little crazy. And then things just kind of fell into place. And that's, I started off really with a passion more for hand surgery and for reconstructive surgery, reconstructive breast surgery, like after patients had breast cancer. And, that's really like where it kind of stemmed and started. And as it evolved, I moved to Vegas with the plan of being working more on like the reconstructive side, and the aesthetic side of our practice, of my practice, really just kind of flourished. And so, and I love doing it. I love our patients. Like, I feel like I get to really make a lot of difference for a lot of people, and in a way that they're so much more appreciative almost than the guy who gets 3 gunshot wounds.
That makes sense.
That's a big, that's very true.
So it's a stark contrast to kind of like where I started, but a lot of things are still the same. Like, in terms of being able to help people in a different way, and in almost in a way that I'm really like under the microscope, right? Because everything we do in my field, whatever I do, it gets posted on Instagram.
Oh, that's a good point.
Like whatever that patient has, like they're telling their friends about it. They're showing their friends, like, if you got your gallbladder out, like nobody knows if they did a good job or a bad job, right?
Yep, very good point.
Everything I do is really under the microscope from not only my peers, but like just people in the community and that kind of thing. So I like it because it's a constant challenge. You constantly have to evolve. And I think that's part of why we've been successful. Is just because I'm always trying to get better.
And do you have like an option to do one or the other, like, or do you have a combination of both? Is it just all aesthetics, or is it all reconstructive?
Stuff? Yeah, no. So at this point in my career, I'm like 99% cosmetic.
Got it.
Yeah.
Got it. So even like, just from my own understanding, like when you pick a field and you become an expert in that field, like, do you still have the capabilities to jump into different things if you want to, or like, are you pretty much pigeonholed now?
That's a good question. The most traditional, like, kind of branching point really is like when you finish medical school and go into residency. And that really does usually kind of like determine the track that you're going to stay on. But, in surgery, for instance, there's, 8 to 12 different surgical subspecialties. So there is some flexibility there. And then, my story is, like I said, it's just a little unique because I was really passionate kind of about one thing, and then I was able to be fortunate enough to kind of like step back and just kind of pivot a little bit and take a different course. So I didn't start off wanting, coming from a background of plastic surgeons and saying I was going to be a plastic surgeon. Like I came from a background of nothing, like nobody. No one
you
really
chose your own lane.
Kind of just had to figure it out on my own. And so I'm really fortunate that I found something that I really am like passionate about and that I really enjoy getting up and going to do every day.
Backtracking a little bit, you talk about like breast cancer and stuff like that, and you have to reconstruct it. That has to be powerful with, because that changes people's lives a lot of times, man, and gives them some
really
confidence back.
And it truly was like something that's and like. There's amazing centers like across the country that are doing this type of work and stuff, and it's more about without getting like too controversial. Like it's more about getting like the health insurance companies to kind of help participate in that, though. Like, which is why I just didn't want to even be involved in that headache anymore. So I almost feel the big complaint people have about medicine is like you show up for a service and nobody knows like what the bill is, right? Like. It's like they charge one person one thing, the other person another thing. I feel like I'm in the purest form of that business because everything I do, you're gonna like. There's a price, and you get that price.
You pay exactly what's on the paper.
There's no like shell game. There's no switching and fixing. It's just very like clear cut, like where everybody ends up.
That's great.
How do you like navigate the pressures of it? Because it is elective and it is cosmetic, and people go in there with a big expectation of how they want to look or how they want to feel, and it's not one of those things you could do it, and then if it you mess up, it goes a different direction. Like you're pretty much locked in at that point. So to me, it's a lot of pressure. And obviously, you're very experienced at what you do, but Like, how do you navigate that situation a little bit?
Yeah. So there's two things. Okay. So the first thing is very much what you actually you kind of alluded to it is management expectations. Okay. So from the moment I meet a person to talk about what they're looking for, I want to assess like what their end goal results are, and I want to make sure that their expectations are appropriate. My office, and this leads into the second thing, is that I'm very pessimistic. Okay, so like I'm always thinking of kind of like what's the worst case scenario when I'm talking with people, because like I don't want to disappoint someone who's coming to me and like they're putting their trust in me or whatever. So I tend to be very much like, when I'm meeting with them, I'm like, okay, well, this can go wrong, well, this can go, and I try to put things into perspective that this is surgery, that everyone's human anatomy is different, that there's sometimes things we can't predict. Now that being said, usually everything's great and everything goes well.
Yeah.
And from that standpoint, I'm even pessimistic about myself. I'm like, man, all right, what is this patient not going to like about their result? Like when I'm looking at them on the operating room table, sometimes that means I got to like take those stitches out and like redo it or reclose it or cut some more skin out here or change the shape of the nose a little bit, because I know like, okay, I don't want this. I want this person to be happy, and I don't want them coming back and expressing disappointment. So maybe I'm a little bit of a people pleaser. I think that that's probably like factors into it a little bit, but I think like for most people, I don't think it matters what type of career you're in. I would say an overwhelming majority of people just go to work and they just kind of like go through the steps and they don't think about the steps. And I think, a big part of success in whatever field you're in is just pausing at each step of, whatever you're doing and just evaluating yourself and evaluating your result and evaluating what you're doing and saying, having that self-reflection to realize like, okay, is this going the way I want it to?
Sure,
or do I need to make an adjustment or pivot a little bit? So, and I think in my field, that's like very important.
Yeah. Does it seem like it's like, for example, like I think it was Korea, right? South Korea is like that's like the capital for cosmetic, surgeries and things like that. How do you feel we compare, in the States compared to what they're doing there and, the transition with technologies and things like that?
In terms of cosmetic surgery?
Yeah, cosmetic surgery.
No, we are just as good, if not better, when it comes to developing new techniques and all that kind of thing. The difference is that healthcare in the United States is obviously very, very expensive, right?
So I was getting that.
It's very, very expensive. And in other countries, because they have different standards of everything, like of not in a bad way necessarily, but like the cost of doing business is just so much less, and so the cost of those procedures is less, which lowers
there versus here.
Yeah,
correct.
So the barrier for entry is much lower, which just means the volume is much higher. And when you really like increase volume, you are going to you're going to get better, and you're going to be known as being like the place to get something done. So so the volume in places like Korea and Taiwan is just so much higher. Because they are able to do those procedures at a fraction of the cost that we do them here in the United States. It doesn't necessarily mean that they're better. Like when we look at, in our medical journals, like who's doing the cutting edge research, who are the people who develop these techniques. A lot of it did come out of the United States. Not to say it, but they're doing some awesome stuff over there too.
For sure. Yeah.
You're seeing like a lot of people now, to your point, going to places where it's a little bit cheaper, like Turkey and Mexico.
Brazil,
and a lot of those are very, nervous, but I'm seeing even more and more people here locally going to Mexico for surgeries. Like how do you?
Yeah. So this is obviously like a very touchy subject, because when you look at it on paper, you're like, oh, I can go here and it's a fraction of the cost maybe that it is here. But the standards of what are offered are very different. When I do surgery here, I am in a state certified, accredited surgical facility with every life-saving measure, like known to man, that if the lights go off in all of Vegas, I have, the capability in the facilities that, there's going to be power in my operating room, And there's a lot of like life-saving technology that's like available, and that's because we're in the United States.
I would have never thought of that. I would have never thought of that, dude.
That's the standard here, right? And so that's not the standard when you go to Mexico. That's not the standard. And not to say that those, like I said, that they don't have good doctors, but in good facilities, but it's different. Like anyone who's been to Mexico just knows you go into any sort of restaurant, it's different.
Yeah.
So those are the kinds of things I think that people, sometimes they willingly overlook because they're just very focused on price and cost, and usually say, there's certain things that you want to try and find the best.
Yeah, that's not one of
them. So maybe this isn't one of them, and because that cost is like correlates to something. Like there's a reason why things just are more expensive here.
Yeah.
And so there's obviously been horror stories of people going to other countries. I know like recently there was somebody who went to get a tummy tuck in Turkey and they took out her kidney, and so there is like that kind of stuff that happens, but and that doesn't happen in the United States.
That is true. All the horror stories I hear from different countries all the time.
So there is, the reality, like you guys talk about business and stuff like that. The reality is there's a market for everyone, and
sure.
I mean, the people who are going to prioritize that, like if cost is like your ultimate like priority, like that is the thing that is most important to you. It's not
a lot of times it moves the needle.
Your safety. Then you're probably not the right patient for me, because like that's not what I'm focused on. Like my goal is not to do your surgery as quickly as possible. My goal is to get you the best result, right? So so that's going to be like it's almost like a self-selecting thing.
Got it. Okay. Yeah. I'm glad you brought that up, because so you have a specialty like with the scar-free breast augmentation, right? I did not know you do this. It's underarm or is in the crease of the underarm?
Yeah.
I don't know. Okay.
So, we're in Vegas. There's a lot of entertainment, a lot of people who work at cocktail waitresses, people who work at the day clubs and stuff like that. People don't want scars. Like we're in Vegas, we show a lot of skin, right? Yep. So a lot of my patients do. They want to have those results, but they don't want the stigma of like having undergone surgery. So a technique I learned, when I lived in Texas, was how to do breast augmentation using an endoscope, going through an underarm incision, and that, for me, I just said like, hey, if I was a woman, this is the way I would want it done. Like these results are really, really awesome. So it's something that I personally like went out and looked into and tried to learn, and kind of put my own energy into it.
Yeah.
It's not something that's commonly done.
I never heard. Yeah. When I was doing, I was like, wow, I didn't even know you could do that. Yeah.
Yeah. There's a few barriers, like as a plastic surgeon, like number one, there's some special equipment that you have to have and that you have to kind of be trained on how to use. And so that's a big limiting factor for a lot of surgeons.
Sure.
The other thing is most surgeons who do a lot of breast augmentation, they do a lot of them very quickly, and obviously going through this technique takes a little bit longer. And so there's just people that are like, nah, I'm good doing it the way we do it. Yep. And again, like we offer every different sort of incision, but the thing that people travel here for, if they're coming to me for an augmentation, it's usually because they're like, hey, you do this and you do it well, like with some of the new advancements in our newer implants, the use of funnel devices, our understanding about like some of the long-term complications associated with implants. Like
that's what I wanted to ask you about. Yeah,
I get the same results, if not better, like using this approach in my patients than I do with other approaches. So it's something that I like it, because like I said, if I was doing a breast augmentation, that's the way I would probably
yeah, very interesting.
How does it, like, because you hear a lot about that, right? You hear about people getting breast implants and things like that, and then you hear them being removed for some reason, right? Maybe is it the I don't know what you would call not the material, but what are you putting inside a person's body? Like what is it that's actually going inside their body that it's getting better, if that makes sense? I don't know if I'm asking the right question. Because I'm hearing a lot of stuff about like the stuff they used to use back in the day was horrible, and then now they take it back.
So the first, going back to like what the first breast augmentation was, done with a sponge.
Oh, okay.
A sponge.
Yeah,
so we've come a long way.
Got it.
Okay.
Very good point. Yeah.
So now we're using highly cohesive medical grade, silicone is, what most surgeons prefer. There's still like saline options out there, but like, we're using cohesive silicone, meaning like if you cut this thing in half, it just stays there. It's not going to like leak through your body. So the implants we have are very safe. The reality is there was a moratorium put on silicone implants in the 90s, and everyone had to use saline. And there was thoughts that silicone implants may cause cancer, may cause do all these things, right? This is one of the very few devices that the FDA has ever like come back and said like, we did a lot of research on this. We did multiple studies. We looked at all the data from Europe and all over the world, and we don't have anything to say that this should not be FDA approved.
Got it.
You know what I mean? So it's very rare for the FDA to like turn and then come back. You know what I mean? So so I feel very confident in the safety of of the devices that we use and the prostheses we use. Now, there's no doubt that that there's a very small group of patients that have something called like breast implant illness, where they're having symptoms of that are very non-specific, and they really feel like it's their implants that are creating those symptoms. And
I hear that. I've heard that multiple times. That's why I wanted to ask you that. Yeah.
Now, the hard part about this is that these are very non-specific symptoms, and these are very like inability to focus, restlessness, heat intolerance, cold intolerance, weight gain, mental fogginess. These are all things that, like, I don't know about you, but like
adds to your balance, to your body. Yeah,
no, but
that's me all the time.
That's just me getting older. Like that's just me not being 20 years old anymore, right? So there is some. It's very, doing all the things that we do, we're not really able to like to really hone in exactly on like what's happening.
Sure.
But what my approach to this is just, if you feel like this could be a factor, like this could be creating this problem, we'll take them out. It's not a big deal.
Yeah.
And I can tell you that, for a lot of patients, that just gives them that peace of mind. Now, I will say also that there is a little bit more of a trend of patients who are just, they've had their implants in for 10, 20 years, and they're like, I'm just done with them. It was fun. It was fun when I was, when I was 20 years old or 25 years old, and now they're in their 40s and they have like some extra weight or maybe, and they just kind of want to be smaller, busted. So it's not uncommon to remove the implants and and do a lift or do whatever we need to do, and I think that that's awesome, because I think we're seeing, like I said, like, just because you have an operation when you're 20 doesn't mean you have to like keep getting implants till you're 90 years old or whatever. We can always take them out, and different phases in life. I think one trap people sometimes get caught in is, they're like, oh, well, I want to do procedure X, but I got to wait till this happens in my life, or I'm done having kids, or I'm done, and the truth is you're only going to be this age today, so if you want to enjoy that, live in the moment, that kind of thing, like we can always do other stuff later. We can always take them out or change things. There's obviously some exceptions to that. We don't want to like be doing tummy tucks and people who are going to have more kids. But, enjoy it now, and we want our goal is really to enhance your natural anatomy and your natural self. So, just make you kind of the best version of yourself where you are today. Like if you're 25, I can make you the best version of your 25-year-old. But when you're 35, I can't make you the best 25-year-old. Like,
that's a good point.
It's going to be
So you're honest. Like, go back to Chris's point we was asking you earlier. Do you have to tell a lot of people no? Like, hey, this is not realistic on what you're trying to accomplish?
Luckily, I do not, because I am very fortunate that I just have a lot of really normal patients.
That's good.
It's not like what you see on TV, like Beverly Hills, and they're all coming in with their giant lips, and they're like, whatever, and they're all crazy or whatever. It's really just a lot of normal people. It's just, I got 2 kids at home. I'm, I work out 6 days a week or 4 days a week, and I just can't hold it all together kind of the same way like you did, before. So they're looking for a little liposuction. They're looking for a little, things to be a little tightened up. And like I said, so I am very lucky. I don't know about other offices, but for the most part, I have very normal patients, and they're normal people. And
What's the percentage of like men that you work on? Did a lot of men get, plastic surgery that they're getting done?
So I think
at your office, I'm saying,
no,
it's just in general.
Yeah. Nationally, it's probably like 10%. In my office, it's more like 20 to 20.
Oh, so you do a good amount.
We're very high.
Oh, okay. I didn't realize that.
In that sense, for a few reasons. One, I do a lot of rhinoplasty. I do a lot of like men for noses.
Okay.
And then I also specialize a little bit in gynecomastia surgery, which is male breast tissue, and which has been one of the most gratifying procedures that I do, because it is literally like a lifestyle debilitating kind of thing for the men that I see, in the sense that they're like, I can't wear certain clothes. I'm really nervous to take my shirt off at the pool. Like I don't feel comfortable like wearing certain things, and how like my chest is going to show through.
Yeah. Okay.
And it's this like super common thing that guys do not want to talk about. We don't all like sit together and talk about.
I didn't even know that was a thing. I didn't even know it was a thing till you just brought it up right now. Yeah.
Yeah. And so, it's, but when guys start finding it or start looking for it, they usually come across our website, and we just have lots of pictures. We have hundreds of before and after photos of every procedure. So, they kind of get the idea that we treat a lot of men, and to that point, like I try to keep our office relatively gender neutral, I guess you'd say, just because like there's no reason the guys can't look good too. Of
course,
everybody. There's when it's not about vanity and it's just about being like the best version of yourself, like that's everybody. That's not just a woman thing. That's all of us. We all kind of, whether it's doing it in the gym or diet or like it's a synergistic thing. Like we try to add all those things together. It's how you get to the best version.
Yeah, and, one thing I'm curious about is like you're one person, right? And I feel like it limits the amount of growth opportunity from a business perspective. As you continue to want to drive and promote and compete and, try to get people into the office, by doing the right things. But really, isn't there a ceiling of how much you can realistically do? And how do you manage that expectation of how you want to grow?
Yeah, 100%. So, you hit the nail on the head, right? I mean, among most surgeons, not just plastic surgeons, obviously, but like, everyone in their respective field is always thinking of like, what's the exit strategy?
Of
like,
course,
how am I going to move on to like the next thing? And I'm in a field where like, if I take vacation for a week, like we don't make any money. Right? Like I have to literally be working with my hands for the office.
Yeah, just stops.
And we have to be getting good results and all that stuff. So it is a hard thing because it's very, very difficult to scale. And I know that there's one group over in I think North Carolina who's they've got like a pretty big group, and they're trying to figure it out. But even they have a lot of problems because the problem with surgeons is like, let's say like we want to like recruit another surgeon, is we're all pretty smart. Like we're all went to medical school. We all want to be like the hero kind of our own story, right? Like and everybody kind of wants to like build their own thing. So it's hard to create a model where like you can kind of scale and grow that way. So so to answer your question, I'm just probably going to work forever. I don't know.
Make good investments. There you go.
Yeah, make good investments. Yeah, exactly. I think but seriously, like I think that's where it goes to like creating the right brand.
Yeah.
That it is true that our results really are, I think, what have propelled us to our level of success, like that we do get really good results, but it's that other side of it. It's that the infrastructure and the logistical side of how you treat patients. We're able to manage a large number of people, of patients, and give them all like an individualized and kind of in a personal experience. That's hard to do. Like that's, and being able to kind of figure that part of the model out is just as important as learning how to be a surgeon or a doctor, or because like I said, people have a choice. They don't have to come to you.
So it's almost you got to create the demand, create the experience, and obviously give the results. And ultimately, the goal would be to have so much that you can raise prices, et cetera. And that's what really drives the growth.
Yeah, I hate this cliche, but that plastic, like we're like art meets science and all that kind of stuff. Like it's very cliche, but very true that people pay very different prices for artwork, right?
Yeah,
and it's very much based on some of its reputation, but obviously it's result and expectation, and there's a reason why some people can charge exponentially more for a surgery than other people, and a lot of it has to do with that they've
shown proof in the pudding,
proofs in the pudding, and that kind of thing. So there is some of an extent of that, and I think it's based on your personality too. I think my office attracts a certain type of person, and and it's probably like just based on my own personality, like people seeing my own personality like on social media. People like said, like coming in for consults, and if they like our office or if they don't like our office, I always say there's a plastic surgeon out there for everybody. And if you were to take all the plastic surgeons, just in Vegas, for instance, we all have very, very different personalities, and that's kind of the nice thing about it, right?
You got choices.
As the patient, you got choices, and you can find the person that you vibe with and that you like. So.
How do you feel about like the new kind of social media, Hollywood kind of mentality that, or almost even the Kim Kardashian, transition of everybody wanting to look, look like that look, right? Do you feel like it's hurting the youth or helping the youth?
So this is something that I have to deal with every day, right?
I know,
because I'm on social media every day, and we're showing our results every day, and then I'm also getting like the Instagram bots that are flagging my content, saying that it's not safe for children, that kind of stuff. So trust me, like I'm like very aware of what of that we need to be sensitive to that, and and I have 2 daughters myself. I think the perspective of keeping it educational. That these are the things that are possible. These are the things that we can do. And then also like trying to be like real with results. Like plastic surgery can create some amazing results, but like the process, there can be a lot of fluid. There can be a lot of draining, right? Like there's a lot. There's a medical side to it too, right? And so. Being able to be open about like, hey, like this is a procedure. This is what it is. This is what it isn't. Making like showing honest photos, not altering any like content or something like that. Like just being real with people. And I think that when it comes to people having and then not attributing necessarily like value to that sort of result. I'm not telling people like, oh, this person got a rhinoplasty, now they're so much better than everybody else. Like, and I think that that's important. If content is being exposed to like a younger audience, that they're not perceiving that somehow getting plastic surgery is going to like make them more of a person or more of a human.
Yeah, love that. Yeah. Do you have to talk with your daughters about that? Because I talk to my boys all the time, man. About
luckily they're still very young.
Okay.
They're 3 and 4. So
what do you do if they come to you and say, "Hey, Dad, I want to get some breast implants, man"? Would you try to talk them off the ledge, or would you applaud it? Yeah.
No, I'm totally for like self-enhancement and self-improvement. I think it's more about like understanding the motive behind it. So same thing, even when a patient comes in my office and they say they want a rhinoplasty or a breast augmentation, it's like, why do you want this? What's your goal with this? Like, what are you trying to do? And like I said, like most of my patients are pretty normal people. They just say kind of like normal stuff, and I appreciate it. It's when there's other answers like, oh, this is, I'm trying to get into promotion with my career, and I keep getting passed over, and I think it's because I'm not pretty enough, and they keep picking the young pretty girl, like that kind of thing, and that kind of secondary gain. That's usually not good, because then they're really attributing that value to like a lot of their external value to like something that they're expecting me to be able to get them, which
Yeah.
it doesn't work that way.
Yeah.
you know?
There's a
It never works
psychology
that way.
side to it. Yeah, it's tough.
Yeah, for sure.
Yeah. I like how you were talking about the education too, is really sharing, the education of everything too, which is awesome. Yeah, that's good stuff. What do you think is like the biggest misconception about plastic surgery? Because I like you were talking about like doing hand surgery and nose surgery and, breast cancer and things along those lines, reconstructive surgery. But what do you think is the biggest
misconception of plastic surgery? Okay. It's probably that everyone asks me, like the first thing people say when they hear plastic surgeon is, "Oh, did you ever watch Nip Tuck?" Like Nip Tuck. Like people imagine that guy driving the Lambo on Miami Beach, like, and being a big womanizer and
it was like a reality show.
It's like a scripted show.
It was a scripted show from the 90s, and and everyone just assumes that it's like this big flashy thing. Sure. And actually, that's why I commend like the show Botched. Like I love like that show Botched because they're very real on that show. And like those guys are pretty like very real, and they're all about setting those expectations, and and they're like just kind of normal, fun guys.
People. Yeah. That's good.
And so the ability to like I said, talking to people is when someone hears I'm a plastic surgeon and they don't know anything about plastic surgery, it's always men, by the way. Right? Like, women, like girls know. They know
That's
what's
me
up.
all day. That's why I wanted to sit down with you because I have no clue anything about plastic surgery yet.
It's usually guys. It's usually the guys, and it's like you just have to be kind and just like I said, I think just normalizing it. Like, I got a job, I go to work, I just try to do whatever the best I can at work, and then go home to my family.
Yeah, it's got to be intense, man. Right? It's got to be stressful the position that you're in. At times, I would assume. Who's kind of like in your circle? With us being Vegas circle, like who's in your circle that you can kind of like bump things off, or mentors and things like that can kind of help you and kind of keep you on the right mindset and going in the right direction.
Like nowadays?
Yeah, nowadays, yeah. Or maybe in the past, maybe it's something that subconsciously can help you.
Yeah, you're totally right. I mean, there's definitely times where I feel like I am on an island.
Yeah, by yourself, especially having your own practice. Yeah,
and I think anyone who is a business owner can probably like sympathize with that because there are just certain stresses that are involved with like running a company that, and you can't go to your employees to like talk to them about it. Yeah,
exactly.
Event or what I mean, or man, like it's surgery. Like complications happen. Like it's part of the
what you signed up for.
What we signed up for exactly, and you can do everything right and still like if you chose the wrong patient, they want to blame you or whatever. And I think the things that have really helped me is number one, we actually do have a very good community of plastic surgeons here in Vegas. Like I do know the majority of people around town, and I know that most of them are good. So I know that if a patient like comes in my office and is like trashing one of them, that it's probably them and not the surgeon.
For sure. Yeah.
And that's really helpful because it's always good to have peers that you can talk to. I have people that I trained with, mostly that are in other parts of the country. Literally people from coast to coast that I can talk to about like, hey, like so I have this case, and it's always like that. It's like if I'm calling somebody or they're calling me, it's usually because we gotta like. We have an issue that we want to like kind of like collaborate on or see if we can kind of get better. I'm very fortunate that I did have some really awesome role models coming up through my education to that. I've had some really bad role models too. One of the most interesting role models I had was someone actually when I lived in Baltimore, and I was doing a bunch of research and moonlighting, and I was working under this insanely productive orthopedic surgeon and who had multiple personality problems. Like just to put it like that. And he said, look, man, like when you get out of here, you got to figure out what I did. You got to emulate my good qualities and forget my bad ones. And if you do that, like you're going to be fine in life. And I've kind of taken that everyone has something that they can offer. Figure out like who, try try not to be the smartest person in the room. Try to surround yourself with other people that you can learn from. But just because you are in that situation, like, see, I think that really helps with my approach with people too, is that like I've worked with a lot of what people would consider to be like very hard individuals to work with or work for.
Yeah.
And I think that's because if you go into any sort of situation with the mindset of like, what can I, why, like, this is a person who's clearly successful. Like, how did they get successful? Like, what do they do? Like, what is it exactly that they're doing? Like, maybe it's the same thing that why everybody hates them, you know, like, but they're really good at what they do. So figure out that
solid
side
on
of
it.
it, right?
Yeah, that's a good point.
And so, I'm actually not, we joke about on my Instagram, I'm very much an introvert. I'm not a like social, go meet everybody type of person.
Yeah.
And I think one of the really cool things about being alive today, or like if you're like a youth coming up, is that your role models don't have to be people that you interact with on a daily basis. Like there are a lot of really awesome role models out there that are like on YouTube.
You can see them there. 100%.
Yeah.
Yeah. Like online mentors in a way. Yeah.
Yeah.
For
And
sure.
I mean, and people, and so there are people who I have, you know, I've been exposed to in my life that honestly like didn't really want anything to do with me, but they had a big impact on my life because I saw the value of what they had to offer, and I just tried to take advantage of it like every chance that I had to. Like, they weren't actively trying to mentor me or give me advice or show me like, how to run a business or, you know, any of that stuff, right? It was just something that I kind of internalized myself.
For sure. Yeah.
Yeah.
For like business advice, right? Like there's so many different ways people can go, right? So what would you leave somebody out on? Maybe they want to go to medical school, maybe be a plastic surgeon. They have something else that, you know, a dream that they want to accomplish. What's a nugget that you can kind of leave for them that could be impactful?
If you want to go into business, don't go to medical school.
Yeah.
We'll start there.
Yeah.
We'll start there.
The loans are crazy. Yeah.
Yeah. If your goal is to, you know, be successful and make a lot of money, there's a lot of other ways to do it that are probably going to be more successful. So obviously go into medicine if that's what, you know, you really care about. But, you know, I would say when it comes to like, I'll kind of rephrase the question. Like one question I get from a lot of people are people who are maybe in residency and they've seen what I've done, which is like go out on my own and start my own practice.
Sure.
And they're like, man, I kind of want to do what you're doing. I don't want to work for somebody else. I don't want to work for the university or a hospital. Like what is some advice that you could give me? And so I think the first thing I'd say is YouTube. All right.
Do your own research.
Do your own research. I literally learned how to run a business from YouTube.
Oh, wow.
I learned like how, you know, YouTube.
I love that you're saying this.
How do you start a business in Nevada?
Yeah.
Like, you know, and then there's a 5-minute video on like, these are the things you need to establish a business. Yeah. And then, and you just start doing research like that on your own. And I think that there is, I mean, I know that's cliche, but there is no limitation today to start doing anything that you want to do. You can literally look it up and kind of do it yourself. And so, you know, like it goes to show that there are so for instance, like there are so many highly successful people out there, right? Like doctors, people who went to law school, medical school, but like they can't take that extra step, right? Like they're always gonna like just kind of work for an institution or something along those lines.
Sure.
And they're never going to kind of like excel to that next level. And maybe they don't want to, and that's fine too. But the research shows that it's a very small percentage of people who like step out and like do that next thing and like start a business. And I think, you know, my dad told me, he said that 95% of all businesses are the exact same. They are. And he's totally right. Like it's, you know, there's obviously costs, expenses, there's revenue,
employees,
you know,
marketing,
money that you make. But then there's also like managing people. Like how do you treat people? How do you generate like value? How do you generate loyalty? How do you like all of these things are they're universal. It doesn't matter what
same cookie cutter
what you're doing. It really doesn't matter if you're a plastic surgeon or if you're an auto repair shop.
That's true. Yeah, that's very true.
It's all really the same stuff. It's just a matter of like what you're what service it is that you're providing. So so I think from that standpoint, it's really just like empower yourself to like learn it yourself, and that you know if you can figure out medical school, you can probably figure this part out too. There's a lot of people who didn't graduate high school that are running very successful businesses because they get people.
Yeah,
you know?
I love what you're saying. I love what you said about YouTube, because that's one of my biggest learners. Even though I went to school, college, and everything, but I wish I would have had better YouTube back in the day.
Me too.
Yeah,
I wouldn't have
for
to read
sure.
so much.
Yeah, that's good stuff. Transition a little bit. We always ask our guests about restaurants, man. What's your favorite restaurant in Vegas?
Yeah, no, I've had to think about this because there's a lot of good restaurants in Vegas.
Amazing food in Vegas.
So right now, for sure, though, I had to ask my wife, and I was like, right. It's probably La Strega over La Strega. It's like Town Center. Like
La Strega, very good Italian place. Yeah.
I mean,
we've been there multiple times. Yeah.
They're handmade
She's the
pastas
same
and
owner
stuff,
of-
man.
No, that sounds fantastic.
What was the other owner? I'm trying to remember.
They have
Harlow,
two of them?
I'm sorry. Yeah.
Is that the
Harlow? Yeah,
is
same
that the
chef.
owner?
Yeah.
Oh, okay.
Yeah, same chef for downtown
Awesome.
Summerlin, Harlow, and then you're right, La Strega. Excellent food.
Yeah.
Yeah.
So good. I'm Italian, and I've lived in a lot of places with really good Italian food.
Yeah.
And I don't get me wrong, there's a lot of very expensive Italian restaurants in Vegas.
It is,
But I haven't really liked a lot of them. I felt like they were all kind of whatever. But La Strega, you can tell that
Shout out to La
they
Strega. I
make
don't
their
think
own
anybody
stuff.
brought that up. That's good.
You
Yeah.
know, they
Awesome.
make all their own pasta. They make all their own sauce. Like it's it's really, really good.
I'm gonna check that out. I've never been there.
Yeah, it's very good. Yeah, we've
And
been there
it's-
multiple
and
times. Yeah.
It's reasonable. It's not like too crazy.
Yeah,
So,
that's good stuff. Nobody's ever brought that up. So
Okay.
that's, shout out to La Strega.
Cool.
I forgot the chef's name, but I would have said your name. Was it Gina? Gina, I'm sorry.
Yeah,
Chef
Gina.
Gina. Yeah,
Yes.
we met her before. I apologize, Gina.
I think I met her too. Yeah.
She's great. What else is up for you, man? What else is that we forgot that you want to leave us out on, man? That we didn't ask you.
If anything, I feel like a lot of stuff we talked about is
Yeah.
it's not even like plastic surgery.
Yeah,
and
setting
stuff
some
because
light on
it's
stuff.
not-
Yeah.
The plastic surgery is just kind of like that's just the side.
Sure.
That's the stuff that we do, and
Yeah.
I mean, but a lot of it is more of the ins and outs of like the running the business, and
good
I
stuff.
think that's really important.
Yeah, I think you said a great point about, all businesses are the same, but the service is what changes. And I think that's really focusing on those pieces of what drive a business are extremely
100%.
important.
Well, give my dad credit for that.
Yeah, that's a good one. That's a great one.
Yeah, no, that's awesome. Yeah.
Yeah.
What's your social handles, man? That people can reach out
So
to.
you can find me on Instagram is where I post most of my stuff. That's Dr. Costa _platinum.
Yeah.
I say that's kind of my working resume. You can see like exactly what I'm doing every day. Pretty
A lot
much
of fun
on there.
times. Yeah, yeah.
As long as we're not getting banned by the Instagram
Yeah.
bots and all that kind of stuff. Obviously, we're looking at growth. We're definitely looking at expanding. We are. Kind of that question about like how do you scale in surgery? It's literally something I've been asking myself like for the last like 5 years, and I know that some people have done it, but I've also seen them not do it very unsuccessfully. And lots of hurt feelings and
Sure.
There's some statistic like. Very high percentage, like over 80% of people who join a practice will leave within the first 3 years, like in our field at least. Yeah, it's very, very true. So it's trying to find a model that will be successful for growth and longevity, but also like treats people fairly and like keeps people happy.
Yep.
To where they like want to stay in it and they don't feel the need to leave, because there is a paradox of if you're starting a business and you find someone who's very successful or who's very good, like you want them to kind of like that's who you'd want to hire, right? But if they're very good, they probably want to just go out and do their own thing. So it's hard to find talent, and that's something I've even just in my own business with across the board from our nurses to our MAs and everything is trying, finding and retaining talent, like, which I know is something that people talk about, but like
very hard.
It's something like it's definitely hit me a lot over the last couple of years, in the sense that like you can't grow almost until you have those pieces in place, and it's almost like anytime you lose someone like that,
you have to restart.
You have to almost restart, right?
Yeah.
Yeah, exactly. And it's like, okay, like trying to move forward. So that's the goal is trying to grow in a way that is going to be successful and long.
And doing it the right way. Yeah.
Doing it the right way, which means like long term and where it's sustainable, and and hopefully I can maybe take a little vacation.
Yeah.
Take a break. Yeah, take a break, man. Well, we applaud you, man. We appreciate you sitting down with us, man. And shout out to who connected us, Lindsay Feldman with Brand Bomb PR. Known her for a while. And but we appreciate you, man. And definitely check us out at thevegascircle.com. So thanks for your time.
Thank you so much.
Awesome.
Appreciate it.
Thank
That
you.
was good
Great
stuff. Yeah.